you want your healthcare to be safe? We all do. But the Trump administration is cutting an agency that has time and time again shown to improve healthcare, all while saving costs. And my colleague and I wrote about this in a new op-ed. The agency is called AHRQ, the Agency for Healthcare Research and Quality. Most people haven't heard of this agency, but it's the only federal agency focused on how healthcare is delivered. The Trump administration is proposing a massive cuts to its budget, but also 90% cuts and reduction into its staffing, which essentially hinders anything it can do and essentially shutting it down effectively. But time and time again, this agency, AHRQ, has been proved so effective and useful at the output that it produced. One of the major achievements that they've actually had is reducing hospital-acquired infections, so infections that you get in the hospital, by over 20%, which has translated to over $28 billion in costs. That is real savings and real effectiveness at patient outcomes. AHRQ also supports the U.S. Preventative Services Task Force, the agency that determines which types of treatments or which type of screening programs need to be covered under the ACA free of cost, and that one is also being attacked by the Trump administration. The agency also funds scientific training programs for the next generation of science who are focused on improving healthcare outcomes and healthcare research and how it's actually delivered, not just bench science. One of my favorite lines from our op-ed is, I'm just going to read from it, is it remains unclear how cutting a historically effective federal agency that has saved billions of dollars and tens of thousands of lives while accounting for only 0.02% of the HHS budget can be seen as useful to the United States economically or for its public health. Cutting an agency that has proved effective for us economically and for our own public health makes no sense whatsoever, and I hope that you can contact your representatives about this issue.